name is Diana Ivy Cedeno, and today I'll be talking about how to properly put on your personal protective equipment, or PPE for short. So, standard precautions, you would just need gown, a surgical mask, gloves, and then of course you would want to wash your hands before and after exiting the patient's room. And so other than the standard precautions, there's 3 other transmissions that you would want to worry about. So the first one is contact for patients who have influenza, and for that you would just want to use the gown and the gloves, and then of course wash your hands. The second one is droplet transmission, which would be C. diff, and for that you would want to use your gown, your gloves, and then you would want to have eyewear protection, and then of course always wash your hands. And then the third one is airborne transmission, which would be patients who have TB, and for that you would want to use your gown, your gloves, and then you would want to use a higher mask, which would be the N95 mask, which looks like this, and then of course you would always want to wash your hands too. So before entering the patient's room, you would want to go over their chart to make sure you know any orders that the doctor has or anything, and you would want to know what type of transmission that they have. So for example, I will be showing you for patients who have airborne transmission, so a patient who would have tuberculosis or TB. So for that, you would use the gown, the N95 mask, gloves, and then hand sanitizer or washing your hands. So to properly put that on, but extra precaution that you can also use are shoe covers and a cap. So when you want to do that, so after you look at the patient's charting to see what they are, so this patient is an airborne transmission, you would want to put 3 mLs of hand sanitizer in your hand, and you would want to do proper hand washing, so make sure that you're mixing it in for at least 15 seconds or until the hand sanitizer is fully dissolved. So you would start off by putting on your shoe covers, then put on your cap, and then you would put on your N95 mask next. So how you would want to do that is you would want to cover your nose and mouth, put on the bottom strap, and then put on the top strap, and make sure that it's secure so there's no cover going in. And then you would want to pinch in the nose a little bit, so that way you would make sure that nothing is going in, and you just want to make sure that it's secure. Then you would put on your gown, and there's ties at the top. And then there's another tie that goes around your waist. Then you put on your gloves. And then after you put on your gloves, you would just want to make sure that it goes over your gown, just so you would reduce your skin exposure. So that's how you would properly don your PPE. So how you take it off, it's the same order. So you would take off your shoe covers, take off your cap, then you would take off your mask, and how you do that is you just grab the center, pull it away from your face, and just take it all over your head, and then you would dispose of it in the biohazard can. Then next, you can take off your gown, and the easiest way is you would just cross your arms, pull away from your body, and then you would roll it into a ball away from your body. And you would want to make sure that you keep your gloves on just in case there's anything else on your gown and you wouldn't want to touch with your bare hands, and then you would just dispose of that in the biohazard can as well, and then that's when you would take off your gloves and dispose of those again, and then again you would do your hand washing 15 seconds or until the hand sanitizer dissolves, and that's how you would properly take off your PPE.